Namaste. I'm Dr. Shwetha. I'm a fertility consultant and a laparoscopic surgeon. I practice at Janisthaa Fertility Center and Multi-Speciality Hospital, which is situated in Basaveshwar, Bangalore. We have different types of vaginal discharge. Sometimes it could be normal, sometimes it could be abnormal. Now, what is normal? Normal vaginal discharge is a discharge that happens which is white in color and which is non-itching, and it doesn't give rise to any foul smell or any kind of irritation in the genital area. So some amount of white discharge is pretty normal in women who are menstruating. It doesn't happen during puberty or at menopause. Vaginal discharge at menopause, there are a different set of reasons for that. We have abnormal white discharge and we have abnormal white discharge which is having some kind of blood tinge in it. Now, what is abnormal white discharge? See, suppose if there is a vaginal white discharge which is different in consistency, like curd-like consistency or cheesy material like a consistency, or if there is change in color from creamish white to greenish discharge, which again is associated with some kind of irritation, swelling or difficulty in intercourse, painful intercourse and burning sensation while intercourse. So all these indicate that there is a vaginal infection. Now, greenish white discharge, it could be because of fungal infection or it could be because of bacterial infection like chlamydia, gonorrhea, or there could be something called bacterial vaginosis. Now, what is bacterial vaginosis is when there are some kind of good bacteria in the vagina and the bad bacteria is kept low. Whenever there is imbalance in the vaginal pH, what happens is the ratio of good bacteria and bad bacteria is altered in the vagina. So this is when the bad bacteria has an upper hand over the good bacteria, and that is when you have bacterial vaginosis, and which results in itching and greenish discharge. The treatment for green discharge is different because we have to identify why you are having green discharge. Based on the cause, we need to put you on treatment. Suppose if you are having fungal infection, we need to put you on antifungals. Bacterial infection needs to be treated with the antibiotic. Bacterial vaginosis is one where people can find some home remedies, like you have to have food which is rich in probiotic. You have to have lots of curds and milk which help you to regain the normal vaginal flora. Despite all this, in case if things are still not settled, then you have to visit a doctor nearby, get vaginal cultures done, get an examination done and see are there any other reasons apart from this for you to have greenish discharge.